Laser Talk here on Wstu.
That ain't a good thing.
And back to your host, Dr. Trev J. Rizet.
Hey, welcome back. We're in our second hour. Thank you so much for tuning in. Today in the second hour, I am going to go over some really important information that could save your life, all right? We're gonna give a little 5 minutes on COVID and what the latest is about these vaccinations and what you can expect, and also my future prediction for COVID.
All right.
I think this is something we all really need to understand.
All right.
I am authority on this. I've been trained as a doctor, and I went to epidemiology and infectious disease when I was in college. As a chiropractor, a lot of people have asked me my opinion because I'm a natural healthcare practitioner. I'm not a guy who's going to give you an opinion that Fauci is, you already know. My opinion is going to be more of a holistic, wellness-based opinion. And that doesn't disregard any importance of medical treatment and what's happening, but I think there's people out there that need other options besides the one hammer routine, If the only tool you have is a hammer, then every problem is a nail.
Yeah.
And if the only tool you have is a vaccination, then everybody needs a vaccination. But if you have other tools available, and there are other things out there besides vaccinations that really do work, and nobody's telling you about it, then you're doing yourself a disservice by not knowing about it. So, I think I'm going to do this fairly quickly, okay? We really have to understand that a virus is something which God created, the viruses, created bacteria, created the earth, the planets, the universe, whatever you want to call it. I don't know where he is or how he did it, but I do think that something much smarter than me gave us life. The difference between a dead body and a live body, try to do therapeutics to a dead body. Try to do something to raise them from the dead, or, the life force is gone. There is a life force which animates and runs through everything. It's a common thread. I think a lot of people do understand that. And if you don't really believe in your body's ability to heal itself, to maintain homeostasis, to strive to heal and protect you from the germs and all the bacteria out there, if you don't understand that, you're going to have a hard time doing anything that comes naturally, holistically. You're going to really, really bank on therapeutics that are created by pharmaceutical industries. And the person who says, no, I'm not going to take an antibiotic, or says, I'd rather not get the vaccination, has a very strong belief in the body's ability to repair and heal itself. And not everybody believes that way, trust me. I'm telling you. I've been chiropractor a long time, and we're still only treating about 2 to 5% of the whole population because of the difference between the philosophies. So in medicine and in healing and healthcare, it's something that there's two really basic beliefs about health. And one is called the vitalistic approach, vitalism, and then you have what they call the germ theory. Okay? And that would be considered most medical doctors and medical professionals are based in germ theory. Now, there's another vein of medicine which is confusing with other things, and that would be emergency first aid. And I want you to know that emergency first aid is probably, you can never question that, right? I don't think that taking vitamins and supplements is going to help you if you were in a car accident. Now, it might help you heal from the injuries because you have the nutrients you need, but if you've got a bleeding artery, you need to go to the doctor. And if you have allowed your health to get so out of shape and you've neglected your health and ended up with comorbidities, you need medical attention for those. You've got to get stabilized on those. Hey, I had type 2 diabetes. I didn't take the metformin and the glipizide until I couldn't control it anymore. And I couldn't help myself. I had to get on it. In those 2 years I was self-treating, I suffered neuropathy damage from it. And I'm a doctor, and I knew that my blood sugar was getting better, but the glipizide and the the metformin would have corrected it in like 2 weeks. But I was so against the medicine. I wanted to do it naturally because I'd never been put on those meds before. And the natural approach was changing my diet, losing weight, and eating better. And it took me 3-4 months to 2 years to really to nail that. And then, by then, I'd already suffered with some nerve damage in my feet, even after I got my blood sugar handled. So if I could backtrack and go back to that day when I checked my blood sugar and it was 350 to 400, I was living in Port St. Lucie,
Whoa.
I almost fell out of the chair.
I guess so.
I bought a Walgreens meter and checked my blood sugar. I'm like, oh my God. Went online. It says when you're over 400, you should go to the hospital. And I'm like,
Yikes.
I don't feel like I should go to the hospital. I'm not having any palpitations. I'm not having any difficulty breathing. My pressure's okay. I just have really high blood sugar. And people can have it. It's called hyperglycemia. Hypo is different. Your blood sugar drops. You need to go to the hospital.
Right.
So I thought the meter was broken. I did. I thought, well, this thing couldn't be right.
Yeah.
Checked it again. Still high. Ordered online. Got these little test strips for urine. Still high. I'm like, I got some issues here. And that's when I did my laser, lost the weight, and that's how come I'm a professional. This is what brought me to use my aesthetic laser as a device to help me lose weight. And that's why I call it laser-assisted weight loss. Because what I did was I created a diet that was going to lower my blood sugar, and I did the weight loss, and I did the laser, and I got great results in that 4 months that I did it. But what happened is, even though my blood sugar was balanced, it would still spike according to foods I ate. And I'd had the problem with my feet had come 2 years before that. The neuropathy, the neuropathic pain that came suddenly. I thought neuropathy was a really slow process.
Right,
Dude,
right.
you can get it quick. I thought I stepped on a hot spike in my foot. That's how quick it came on. My whole foot went numb, pain in my toes, and I thought I had hurt. I thought my arch fell in my foot somehow. I'm a chiropractor, or it's coming from my back. So I got adjusted, didn't really change the weight, and long story short, I should have probably gone to the endocrinologist and handled it with the meds right away. It might have left me without the neuropathy. So anyway, not to get into my problems. So let's get back to this part about COVID, all right? So you've got these two philosophical bases of healthcare. You got the vitalistic approach and you got the germ theory. Now the approach to vitalism is that if I can keep you healthy, maintain the right nutrition, the right exercise, food, water, and then support you with supplementation if necessary, that you are less likely to get sick. And that should be a doctor that you should see all the time to make sure that you're still doing that. Exercising, taking care of your health, and also doing things that are non-invasive like acupuncture, Reiki, energy work, hypnosis, counseling, and chiropractic. These are doctors of vitalism. They are not the one you go to if you had a head injury and you're bleeding in the brain. Okay, that's first aid. Now, I think we're very clear on that. The other approach to medicine is what they call the germ theory. And this is the use of pharmacological agents to try to change symptomatology, to try to change your symptoms under the belief that if we can change that symptom, you'll be a healthier person. And that's a failed principle in itself. So I'll give you an example. You haven't been eating properly for a while, and you're starting to get junk in your arteries. They call it arteriosclerotic plaque. Your arteries are getting smaller and smaller, and you're having less blood flow to the different parts of your body, so your blood pressure increases. The body is compensating because of that clogged arteries. It has to raise the pump pressure to get blood, because the mandate is to perfuse the body. That's the heart's mandate. It has one goal: perfuse the body. Get the blood to every part of your body. As your habits from eating improperly have created occlusions and junk in your arteries, the blood pressure has to increase to get through that. So you go to your doctor and you're not really symptomatic yet, but your blood pressure is elevated. So they check your blood pressure and he says, wow, you have hypertension. Okay, what does that mean? That means your pressure's up. Well, why is it up? Well, we really don't know why. No, I mean, they have an idea. Let me give you some diet. You need to do this, you need to do that. And they put you on blood pressure medication. Mm-hmm. And what happens is the blood pressure medication will lower your pressure by either causing you to lose fluid, by lowering your overall bodily fluid. It's called a diuretic. It can slow the heart rate down. It's called a beta blocker. And there's other different ways. There's things that work on you. There's different ways it lowers your pressure. And what happens is when the medication starts to work, your pressure goes down. But you really haven't changed the clogged arteries or the real problem. Now, they told you needed to do something about it. They mentioned maybe if you lose weight and eat better, you can, the pressure will go down. In the meantime, I'm going to write you a prescription because you need this med today. Because high blood pressure can lead to other problems such as stroke and broken arteries. And there's a reason why they lower your pressure. But what happens is, so then you go back to the doctor, and when they check you again, they're like, oh, your blood pressure's holding good. That's wonderful. Have you made any other changes? And the patient's like, no, I'm not giving up my sodas. I'm not giving up the foods. I like it. This is you're taking away anything that's fun for me. I'm a cook. And the doctor's like, okay, we'll keep you on the pressure. And then you go home and you're continuing that same habit. And then you go back. And what happens, and this is an interesting fact, blood pressure, your body will adapt to the medication. Because remember, the mandate is to get perfusion. You take the drug to artificially stop the heart from beating hard enough to get blood to the body. The body's not getting enough blood, and that medication becomes ineffective. The body will compensate in another way to increase the pressure again. So what do? They change your med. They try to go at it a different way. Mm-hmm. So instead of causing you to have low blood volume, they do something to slow the heart rate down called a digital blocker. Instead of getting to the cause, which is your crappy diet and the fact that you've accumulated plaque in your arteries. Now, they gave you a handout, by the way, about how to eat, but they didn't help you do it. And there's no money in it for them to do that, which is another very important feature. If you're going to, once you open up the can of worms and you go in for the medicine and you get those blood pressure meds, there should be another part to it that 30% of that fee is involved in doing some home, healthcare recommendations. It should be inherent with every diagnosis. If I'm going to diagnose you with diabetes, it better cover home care and food and diet and counseling and help. Because just to give the diabetic medication without losing the body fat is wrong. It's incompatible care. It's called the germ theory. And that's where medicine is. So, if you're walking around with comorbidities, meaning high blood pressure, diabetes, a history of stroke, arteriosclerotic plaque, and you get COVID, and you have to go to the hospital, or they want to vaccinate you, and they don't go over and help you with those other things, that doesn't really help you, does it? Because the vaccine is just treating the symptom, just treating one little part. Eventually, the body's going to start to wear out and become sick again, and you're going to be in the same situation, but it'll be a new virus. It'll be something else because you're not dealing with the cause of the problem. Listen, you wouldn't you wouldn't, if you were driving a beautiful car that you just dumped a bunch of money on, you see all these new vehicles everywhere, and the oil light came on, and it tells you there's something wrong with the oil system, and you went into the station, and the guy comes out, and he's got, I mean, this guy is the best mechanic in the world. His mechanic shop looks like a Porsche dealer. And he walks up to you, and he says, wow, your light's on. Let me just take a little magic marker and cover that light over for you. Okay, you're good. You'd be like, what do you mean I'm good? Hey, that's all that's needed. Really? That's all that's needed. Look at how successful I am. Look at all the people that come in here. And you're like, well, you know, there's a leak somewhere. No, all we got to do is cover over the light. And you'd be like, you know what? I wonder if he owns the engine repair company too. Because you know what's going to happen. That leak is going to cause your motor to fail, and then you're going to go back to it, and he also owns the guy that fixes the motors. That's his buddy, his brother. I mean, and then, right? It's not that out there. That's not that unusual to say that. You know, when you go in with symptoms to your doctor and they give you pills and drugs to stop symptomatology, you know, the caboose is coming.
Right.
The problem is coming. They didn't do anything for you other than lower that symptom so you can get sicker. Eventually, the drug won't work and you'll be in some god-awful situation where, thank God, you'll be so grateful you have your health insurance. Man, you got to stop that. The only way to take charge of your health is to be healthy. Nobody's going to do it for you.
Yeah.
Nobody's going to care. You can't leave it up to your wife to manage your food intake. You can't leave it up to your daughter to come home and, you know, her nagging is fine. You got to be willing to do it on your own. And there's a lot of, you know, places to do that. I would tell you that for most of you out there that refuse to do it, you will need professional help. And you want to go to a doctor that has an approach which is vitalistic, not symptom-oriented. That doesn't mean that symptom care isn't important, as I've told you, but what's really important is your overall ability to make those changes and to have someone who can support those changes. And that's what we do at the Slim Body Laser Spa. You know, that's what I do. I know all about the symptom care. I know when somebody's on medications, what systems are probably being taxed, why they're putting you on the drugs. I don't even have to talk to you about your symptoms. I can look at your meds and know everything that's wrong with you just by the medication you're on. And I also know that the condition why you're medicated, I have natural remedies and suggestions and things we can do to help lessen that burden of that condition, and possibly you can get off some of those meds. It isn't just because you're put on meds and your condition has been going on for years and years doesn't mean that you can't reverse it. You live in a body which is replaced from the top to bottom every 2 to 7 years.
Isn't that amazing?
Every cell in your body, cells don't heal, they die and new cells replace them. The lining that lined your mouth, your mucosa from your mouth down through your gut out to your butt, is replaced every 5 days, every cell.
Wow.
It's a lot of wear and tear there. Your blood cells are replaced every 6 months, 180 days. They're brand new blood cells, every blood cell. Your tissue, your muscle cells are replaced every 3 to 4 months. Your bones, architecture is replaced every 2 years. It's as if you lived in a house that every week or two somebody came over and said, we're putting in a new floor today. Oh, well, it's not even old yet. Yeah, but that's what we do. We put a new floor in. What are you going to do next week? Well, next week we're going to put all new wiring in. Really? Yep. And in 2 years, your house is brand new from top to bottom. So I ask you, how could you have chronic disease? If your body's replacing itself every day in its entirety within 2 to 7 years, how is it that you still have that chronic problem?
Yeah.
I can tell you why, Because you're creating the same thing. You haven't changed the habit which created it. So the new body is simply dealing with the same problem again.
Amazing.
Again and again. And what's really incredible is that anytime you want to change and bust a move to say, I am done with taking these meds, I don't like how they make me feel, I'm more worried about my insurance and Medicare Part D than I am, enjoying life. I want to start eating better. I want to start losing weight. I want to get off these meds. Anybody can do it today and get some results. Some conditions are tough, others aren't, but you got a shot. I can tell you that it works. When you have professional help, it's a lot easier because you're not going to be wasting your time trying to figure it out, buying stuff on the internet, just ripping you off. I mean, God, I would think that 80% of the internet is false. I don't know. It shocks me what I see on the internet. So you want a medical professional that has a license, has a has something to lose if they were to take advantage of you. Anyway, Slim Body Laser Spa, that's what I do. We use a laser to help with weight loss. We use whole body vibration to help with detoxification and strengthening your body. And then we sit down and we make common sense nutritional recommendations. We do not sell a bunch of pills that you got to buy. Okay, let's get that out of the way. There's a lot of places called functional medicine where they're diagnosing, they take your blood, they take a cell, and then they sell you $4, $5, $20,000 worth of supplements. It's not what we do there, I mean, I'm not against people that need that kind of help. It's better than taking pills and drugs. But to me, you don't have to worry about that there. We just want to be super helpful. Remember, we got these whole body vibration plates. If you want to buy one for a loved one, give it away as a present, we got them. They are $980 a piece. Our laser lipo plan is $2,800, and if you sign before December 31st, you get 6 free sessions, so that's 9 of our regular plan plus an additional 6. You can prepay for it and give it to somebody. If they're not qualified or they don't want to do it, of course, you can have your money back. But if you want to give a person a nice gift, without, just be careful. Honey, I bought you a laser-assisted weight loss program, but I love the way you look. I mean, you're really okay, but are you upset? No? What are you saying, Tom? Are you saying I'm fat? Oh, no, honey. Remember that Abe Lincoln one? Abe Lincoln can't tell a lie?
Yeah.
Honey, how do I look in this dress? Well, that was a great commercial by Geico. Abe Lincoln can't tell a lie.
Yeah.
How do I look? How do I look? Oh, well, honey, I bought you a gift certificate for Slim Body Laser Spa. I hope you love it. It's a loving, caring thing to do.
Right.
And if you need to, you should do it along with her. We have a lot of couples that come in there and do it together and support each other.
Yeah.
I mean,
That's important.
And when somebody comes in together, I give discounts. You know why? Because they get better results. It's less work for us than one person trying to maintain a better attitude and lifestyle when her spouse is not doing the same thing. But when people do it together, it's like they're a shoo-in. I mean, this is the easiest thing I've ever done. So if you've been frustrated before and have failed at weight loss, then my FDA-cleared lipo laser could be the answer for you. We're located in Stewart on East Ocean Boulevard, right across the street from the new Fresh Market. And we have free consultations. And you can come in, meet with me, watch a DVD on how the process works. I will demonstrate the machine to you. You can come touch it, feel it, see how it works, see that it's on. And after looking at your body, no harsh exams or anything like that, just a visual check, I can give you an idea of how many visits and what you can expect. If you prepay for your plan before December 31st, you can begin in January, after the holidays, after you've been fattening yourself up with all the holiday food and cookies.
Oh, yeah.
And
all the breads.
All the breads.
Oh,
and this way you know that you're committed. It works. I do much better if I prepay for things. My dad used to say the The teeth that never fit are the ones that aren't paid for. Get these out of my mouth. They hurt. Oh, you haven't paid. I know. That's why I want them out. Okay, so you can hear this again on Facebook. We'll see you later. Have a great day. Bye-bye. 772-223-5885, drtreads.com. Slim Body Laser Spa. Do it for yourself. Do it for your family.